I hope that really resonates with you. It resonates with me, especially with the number of implementations and systems we've deployed over a long period of time. I'm sure you'll be pleased to also hear that we are members of the InterSystems is members of the Arch Collaborative. We're actually using the learnings out of that to enhance some of our procedures and processes, our engagement with clinicians, our engagement, changing the methodologies of engagement with folk all throughout the healthcare services, but especially the clinicians and especially the doctors. We also think that you as customers would get benefit out of becoming members. So as Everton and John said, they'll be out the back and they'd be only too happy to talk to you about that. We will also be launching our own customer feedback survey in the region. We want to get feedback from you as well, and we intend to do that in the near term, and we'll be making some announcements about that in the coming weeks.
以对生命的敬畏之心，提供安全、专业、关爱的医疗服务。美中宜和，以不凡的价值观成就卓越。欣然的羊水破了，比预产期提前了2周。此时正是城市高峰时段。幸运的是，美中宜和实现多院区间患者信息共享，欣然被送到最近的亚运村院区。
恭喜你们啦！因为通过检查马上就生了，我们直接上产房，好吧？这里我们这么多医生护士都会保证你们的安全的啊，放心放心。
新生的喜悦源自无微不至的关爱与安全周到的呵护。TrakCare 帮助美中宜和获得实时准确的患者信息。
你好，女士，怎么称呼呀？
每时每刻以最佳决策提升医疗服务品质。
自从 TrakCare 系统上线之后，我们能够更加全面地了解客人的信息，在紧急情况下能够更迅速地做出最佳的治疗方案。更改医嘱之后，客人能更快地得到治疗，这样我们的客人都觉得更安心、更安全、更踏实。
美中宜和以患者为核心，借助统一的医疗信息系统，做出更加明智的决策，成就倍加安全、专业、关爱的医疗服务。
Good afternoon. What a pleasure it is to share with you a little bit about AmCare, and congratulations to them. What they're doing and how they're using TrakCare to deliver better outcomes for their patients. I'm Dimitri Fane. I'm the Global Director of Product Management for TrakCare, and it's my honor to be here with you today talking to you about some of the new functionality we've recently developed in TrakCare, a little bit about the pipeline, the things that we're working on, the things we'll be developing soon, and our vision for TrakCare in the future. So, before we go into some of the specifics about TrakCare, I think it's worth taking a look at the bigger picture as we see it in healthcare and consider what's driving digital transformation. We've had a number of speakers today talk about digital transformation in healthcare. I think it's on everybody's mind. Hopefully I won't contradict anything that's come before. I think you'll start to see some consistent messages developing. So we really see 3 primary drivers that are informing our roadmap decision. And you know, as we talk to customers around the world, as we visit our customers and hear from them, these 3 themes emerge as primary. The first is this idea of a decentralized healthcare ecosystem. So if you were to go back in time, even 10 years, 15 years, most of the clients we were talking to were concerned with what happens within the 4 walls of their hospital. You're running an acute hospital, you're dealing with the patients in there. What we've seen happen across the world really is the digitization of health records outside the hospital. We're seeing more care being delivered in primary care, in the community, in different care settings. Statistics vary country by country, and I'm not sure what they are in Thailand, but an older patient will typically see 4 to 5 providers in the course of the year. If you're dealing with a patient with a set of chronic conditions, that number can be much, much higher. These are disconnected systems, but each of these systems is providing data that's relevant to the care of your patients in your TrakCare system. So from both a health share and a TrakCare point of view, we need to be conscious of this data. We need to be considering how to bring it into the workflow, how to get value out of it. The second driver is one that you've heard about again and again today. It's this idea of data intensity. It's generally acknowledged that the volume of data in healthcare is rising faster than just about any other industry. You'll see that over the past years it's been rising, but this is an exponential curve, right? So every year passing is more and more data, healthcare especially. And the thing that's really interesting is at any given moment in a patient's care, today, where we are, there's more data points available than the human mind can consider in decision making. So it's generally acknowledged in studies that a human can take into account 5 to 7 different factors in making an individual decision. Probably a lot of us would like to think it's a little more than that, but that's the science is there, and that's what it is. Even in any of our TrakCare systems today, you'll have hundreds of data items available at each decision point. This is value in the data that we need to consider, and we need to consider how to bring that into the workflow, how to use it to inform decisions and support the providers who, as human beings, aren't capable necessarily of dealing with that volume of decision points. And the third trend is this idea of pervasive disruption. So Maureen from Deloitte talked about this. You'll probably hear about it from other people today as well. I used to think of healthcare as a bit of a laggard industry from a technology point of view. And this is, those of us who come at this from a technology background, it can sometimes be a bit frustrating in healthcare because we see other industries innovating and disrupting at a faster pace. I think this is changing. I think, again, in sort of an exponential fashion, in the last few years, we've seen the pace of innovation increase dramatically. A few years ago, I used to debate with people about whether systems like TrakCare would be hosted in the cloud. And it was, if you go back 5 years ago, the cloud was something you wouldn't ever host healthcare data in the cloud. It's not secure enough. You fast forward 5 years, the technology and the business environment has changed to really open this up. I heard yesterday about our customer Sino United in Shanghai has just gone live in the Ali cloud. I believe that's our first customer in China live in the Ali cloud. We have a number of customers looking at Azure and Google and the various cloud hosting options. That's just one example. So there's pervasive innovation, disruption. This is something that we need to be conscious of from a provider of an EMR point of view, and it's for yourselves as healthcare organizations, because many of you have technology teams yourselves, and you need to consider how to innovate. And of course, while you're innovating, there's always a catch to these things. While you're innovating, you also have to keep your business running. So this is something that we need to keep in mind as we consider these 3 factors, is this concept that Gartner calls bimodal IT, this idea that there's this desire to innovate, this need to innovate, but at the same time you need to keep the business running. Particularly in a hospital system, downtime is catastrophic. You can't radically change the user experience. The training requirements are dramatic. You'll have, many of you have thousands of users who need to be retrained with every little change. So you've got to balance these 2 worlds, this need for pervasive innovation, this drive for disruption, this change in the industry, balanced with the business as usual, keep the lights running, keep your operation going. So these are all things that lead into how we consider the roadmap. When we talk about TrakCare roadmap today, I'd like us to consider these 5 different areas. So we've heard there's a theme emerging, I think, about value from data. That's something that's very much top of mind from a TrakCare point of view for us, both today and in the future. How can you unlock the value in your data? Connecting and coordinating, we've heard about interoperability today, but this also speaks to providing care in all the various care settings, from outpatient clinics to inpatient to operating theaters to emergency, and then out into the community. You've heard a little bit about the remote care in the Northern Territory. Care is being delivered in all kinds of different places today. User experience we'll be talking quite a bit about. That's a major area of investment for TrakCare and a big driver in terms of how we think about the roadmap. Safety and compliance, one of the primary reasons we're all in business is to support safety. And working together is really about how we work together as colleagues, how InterSystems and our clients can collaborate moving forward. So I'll be talking a little bit about that at the very end. So for each of these areas, the way I'd like to talk about this is to talk about current capability, to talk about pipeline, and talk about vision. So current capability will tend to be things that are available today in our latest release. In some cases, it might refer to capability that's been around for a couple of years. You might not know about it. I think one of the things that I find a little bit frustrating sometimes is TrakCare, as you know, is a massive system. We have a lot of functionality, a lot of capability, and if you go around to each of our individual clients, there's with the best will in the world, there's things that they don't even know are available. So we're working on ways that we can provide more training, we can provide more communication. I think it's also incumbent on our clients to ask questions, to talk to us. But I think if you take one thing away from today, I'd like you to walk away with 2 or 3 things you've seen today that you can operationalize tomorrow in your environments to deliver better outcomes, or things you can begin planning, because there's a lot of functionality. Pipeline, we'll talk about things that we're committed to and actively working on and delivering over the next couple of years. And then I do think I want to just talk briefly for each of these areas about the vision, what we're trying to do, what drives us on a day-to-day basis, because we're all extremely busy, we're all working very hard to deliver functionality, but it's important to know where we're going. So one of the questions I ask our clients from time to time, it's a bit of a rhetorical question, but why did you buy an EMR? EMRs are expensive, and it's not necessarily just from a software point of view. That's actually a relatively small percentage of the overall investment you're making in your EMR. You're all running change management programs, you're all working on data normalization, standardization, terminology, training. All of these things add up to be a tremendous commitment from an organization. The reason I would propose you're making this investment is because there's value in the data. You're collecting the data, you're collecting it in a normalized way, a way that it can be reused, both for clinical value and as well as in some cases for business value. That value might be for clinical decision support, it might be for research or various other secondary uses, but you're all sitting on a tremendous amount of value, and we'd like to help you unlock that value. The big change we've made in TrakCare T 2019 is to release it on the InterSystems Iris for Health data platform. So this is, as you're probably, most of you will be aware, it's a major new product announcement from InterSystems. It's the first data platform designed specifically for healthcare. It brings together the best of the databases we've always had underneath TrakCare, as well as the interoperability, the analytics, and all of the operational tools to run a true data platform. The investment in moving TrakCare to the Iris platform does a few things for us today in T 2019, but it's really an investment in the future. It's positioning our product to grow and to help you get value from your data over the long run. We think of it as future-proofing. There's a massive amount of investment going on in the data platform, and as TrakCare evolves, we expect to be able to take advantage of more and more of that. And you as our customers with Iris underneath TrakCare you now have the ability to begin leveraging some of the value from the data. Interoperability is obviously a huge piece of that. I'll talk a little bit more about some of the specifics around FHIR in this presentation, and later today you'll get a much deeper dive into what we're doing in FHIR and interoperability in general. I wanted to highlight a few specific things. This is a new piece of TrakCare called Dynamic Patient Lists. It was introduced in T2019. It's available in what we're calling the mobile-enabled user interface, which I'll talk about a little more later. This is an example of a list. What you're looking at here is a febrile neutropenia list. So these are patients who have a temperature and a low white blood cell count. You can have any number of these lists. You'll note that the top patient on the list was added manually. For all of the others, it explains why they're on the list. For those of you who've had a chance to look at our mobile user interface, you'll know that against each patient, there are these set of ellipses. That's a context menu, so you can take some action against the patient. You can also take an action against the entire list. The number of actions you can take on the list today is fairly limited, but we're looking for feedback in the future to enhance that. There's a variety of things people will want to do with these lists. The configuration behind it is pretty simple. This is intended for clinicians to use. So you select a cohort of patients. We've restricted the cohort of patients because we want to prevent clinicians from producing a query that will span the entire database. So you choose your cohort of patients. You can choose how to share the list. You name the list, and you define a visual rule. So this is all driven from TrakCare Visual Rules, which is functionality that's probably available in the version of TrakCare that all of you are running. I think it's one that's probably not used enough. And in terms of value from your data, I think Visual Rules is an important component of that. So this is an example of the febrile neutropenia list I just showed you, the visual rule behind it. You'll note that it's got a bit of red text up there. That shows you that this rule is used in a dynamic patient list. So that's important because visual rules are something that are often manipulated in the back end within your IT department. It's important that the IT team knows which rules are exposed as a dynamic list and which rules are not, because there's different mechanisms you'll need to go through from a change management and training point of view if you change a rule behind a patient list. I think patient lists are a very user-friendly way of surfacing the value out of visual rules, but there's other things you can do with visual rules in terms of selecting out of your cohort of patients those that you're particularly interested in, those that you need to take specific action, specific intervention. So another way of thinking of value is how can you use your data to optimize your system. Your patients want to leave as soon as possible, and frankly, you want to get your patients out the door as soon as possible. It's good for their health, it's good for your business. This is a new feature from T2019, which is a configuration called the Patient Journey Board. So this is a very simple configuration. It's based around order items and questionnaires, for those of you who understand. Very simple icons. There's only 3 of them, really. So this is showing us that labs have been ordered, but no results received for this patient. Results have been received, and the tick box means they've been received and signed off. The idea of this very simple configuration is to optimize the flow, to get your patients through the hospital, to see on a ward basis at a glance where all the patients are in the process. This is one example, but it's a very flexible configuration. Anything that you've defined as a questionnaire or as an order item can be used on the patient journey board. You can imagine this on a large display in a ward. You might have it at the nursing station, maybe on an iPad. There's a variety of things you might do with it. And as with all of the patients, it's just a patient list. So like with all of them, you've got the context menu. You can jump to any particular patient on that. And again, it's using the data that's already in your system to help you track the patients, to help you get them through the system faster, to optimize your flow. I'm not going to spend too much time about talking about Fire and Smart on Fire because my colleague Adrian will be speaking at the end of today and showing you some demos. Where we sit today, for those of you, Fire is an interoperability standard. Smart is a standard that allows you to define reusable apps that can run against any EMR, and they use the Fire standard as the transport mechanism to move data around. It defines the data in a standard way, so these smart applications can be used against different EMRs. We're in a position today where we're ready to engage with early adopters. The technology is there. We're looking for customers who want to work with us, want to try out some of these apps, operationalize them. I think Adrian's going to actually show you a real example of this. But what you're seeing here is a pediatric growth chart Smart on Fire app. If you've been to a Smart on Fire presentation, I guarantee you've seen that one. It's the one they show at every Smart on Fire presentation. But it's really fascinating because we have, as you know, we have growth charts in TrakCare, but maintaining them, particularly for pediatric patients, is a lot of work. The data changes, the research changes, there's multiple different ranges, and while you could maintain all of that in your TrakCare environment, you may not have the staff to do that. This is a Smart on Fire app that uses World Health Organization data to build pediatric growth charts that are evidence-based and match the latest standard data. So this is pulling observation data from a TrakCare patient, sending it to the Smart on Fire app, and displaying it in the context of the EMR. Another new initiative we're working on is using the InterSystems text analytics technology to do text analytics on text data and bring some value out of that. This is a very simple example where we've taken one document, which you can see the full document on the right, and we've pulled out the concepts. This works with the UMLS database, maps the concepts to healthcare context, and surfaces them. So there's a variety of use cases you can imagine for this. This particular one, I think, is, with only one document, it's a little harder to see the value. But if you imagine a patient that's got 20 or 30 documents attached to their record, being able to very quickly surface the important concepts from that variety of collection of documents might be something that you'd be interested in. And again, this is, like with Smart on Fire, we're ready to engage with early adopters if it's something that interests you. We've had in the last few years, we've engaged more and more with large private organizations, and revenue cycle management is a top priority for them. As a result of this, we've invested heavily in our revenue cycle management capability. We've always had patient billing. It's always been something we've been proud of, very flexible system. We're highly adaptable. I can't even count the number of different countries we have represented in this room, and each of you have billing. And the fact that one single global code base can support all the different billing rules and variations, I think is quite impressive. On top of that, we've invested in additional capability in the last couple of years. This is an example of the payer approval workbench, which allows you to manage all your pre-authorizations before procedures with the various insurers and packages to ensure that you're not about to deliver some care that will ultimately not be paid for. Again, that's another way of getting value out of the data using the system you have. We had a great presentation earlier from HBI and Bummengrad about machine learning. I think if you look at the information we've learned today, the information we're hearing from the market, it's clear machine learning and artificial intelligence are becoming huge drivers in our industry. It's something that we need to be conscious of. The beauty of the IRIS data platform underneath TrakCare is it enables you to surface that data and share it. So with the proof of concept that HBI did at Bummengrad, InterSystems spent about a day to get the data out. It's the data comes out in our standard technology. It's the interoperability platform. There's no particular custom code. It's all there. The HBI were able to adapt their system to accept the formats that we put out, but it was quite an easy task. We were involved with them, helping them understand some of the nature of the data, but the fact that we can surface large amounts of clinical data in a standard XML format that can be consumed by third parties is something that I think it's important for all of you to understand, because as you start to explore these secondary uses, you're one of the things Terry mentioned in the video this morning was this idea that you're no longer looking for a single provider for all of your IT needs. And if you think about the innovation and the change that's coming in our industry, you're all going to be working with multiple parties who are interested in taking the data you've got and doing things with it to surface value. So I think it's important that you understand that we've got robust capabilities today to support that. We will continue to invest as we encounter specific third parties. We'll get better and better at this. I think, one of the last things to say about the value from data today is this idea that, everybody knows the needle in a haystack analogy, that, looking for the right data, you've got this massive haystack. I think one of the thoughts I'd like you to consider is actually that stack is all needles. You're not looking for a needle in a haystack. You're looking at a stack of needles. The only issue is that some of those needles are valuable today for you. Some of them might be for you today, but there's value in all of them. And I think the trick is figuring out how to get that value, how to surface it, how to bring it back into the workflow. And that's where some of the flexibility of TrakCare comes to bear, to take that value and to bring it right into the clinical workflow. So looking forward over the pipeline, we're doing a lot of work with APIs. Again, referencing Terry's comment this morning about other systems that need to interact. So as of T2019, TrakCare has a very robust set of web service APIs. These APIs are available, they're usable by customers, they're fairly low level. So there's a set of understanding about the nature of how TrakCare is built that's required to be able to use the APIs. We're not stopping anybody from using them, but we do recognize that there's a threshold before you can actually really use those web service APIs. So we're investing heavily in FHIR resources as our future. So we expect over the next year to be able to deliver a full set of FHIR resources using the Iris underlying technology. And what that does is it allows us in a standard way to present our APIs in a way that external parties understand without understanding the implementation details of TrakCare or your particular configuration. Terminology is also something we're thinking about ways of normalizing the data, supporting our customers for consistent terminology. It's an area of investment for us. We aren't a terminology provider and we don't intend to become one, but we recognize we need to be able to work with multiple terminology vendors and we need to be able to support our clients as they continue to normalize their terminology. CDS hooks is a FHIR standard for bringing decision support into the workflow. That's something that we're looking at on the pipeline as, again, a standard way of expressing decision support from external systems and surfacing it back into the workflow. So that might come as an alert in something like a drug-gene interaction checking alert. It could also come from a machine learning, something similar to an HBI that wants to say, hey, this patient has an elevated level of risk based on your population of data. That could be surfaced in an alert, or it could be part of a workflow, could come in as a result or an observation item. There's a number of ways of doing that. We're working actively with our clients to make that real. I'd be surprised if anybody recognizes what this is. So this is, in terms of the vision of value from data, this is one of Google's quantum computers. So this was in the news recently because they may or may not, they published a paper and they retracted it, so it's a little unclear. They may or may not have achieved what's called quantum supremacy, which is a very Star Wars sounding concept, or Star Trek maybe. What quantum supremacy means is they've produced a quantum computer that can consistently and reliably beat a traditional sort of Turing machine computer at a particular calculation. So this is more news today for geeky computer science types. But what I want you to consider about this is they designed this quantum computer for one calculation. And it was a bit of an unfair calculation. They chose one that's extremely hard for a traditional computer and well-suited for a quantum computer. This was a calculation that would take the fastest supercomputer today 10,000 years to complete. The quantum computer completed it in 3 minutes. Now, it's completely artificial. It's not particularly usable. Nobody actually cares what the outcome of this calculation is. It's not actually going to change anything today. But in terms of value from the data, I want you to think about that a little bit. 10,000 years of calculation by the fastest computer versus 3 minutes. This is coming. Thinking about Moore's law, exponential growth, the pace of technological change. This is maybe not coming this year, maybe not next year, but I think in all of our lifetimes, we're going to see a spot where quantum computing can actually be brought to bear on some of the healthcare challenges. And if you think about that, I think you start to understand the importance of keeping your data clean, collecting as much data as you can, managing it properly, being ready to take advantage of these things when they come. So connecting and coordinating care, in our demo this morning, you saw a little bit of our personal community product. I think all of our customers ought to have a patient engagement strategy. We'd love it if your patient engagement strategy included our software. If it doesn't, that's okay too. Christine mentioned this morning the integration with WeChat, which is a great piece of implementation in China. But patient engagement is a key part of all of our customer strategy. We support that today either through integration with external portal systems or through our own. You saw a little bit of a demo this morning about telehealth. But again, in terms of current capability, I just wanted to share with you a 1-minute video. This is a potential telehealth scenario. So here's a doctor going into the priority workbench, looking at their patients today. There's a patient today who has a telehealth appointment. This is defined just as a regular schedule, but it's a telehealth appointment. They're reviewing the active clinical notes, looking at the patient record, and there's I don't know if you can read that, but that says call patient. So there's a menu item there that triggers Skype in context, passes the Skype information of the patient, initiates a Skype call, and finds a really weird-looking patient. I don't know about that. But that's, again, this is capability that's available today. You may or may not want to use Skype as your telecommunications technology. You might use Zoom. You might use Microsoft Teams, Skype for Business. All of them, or telehealth, particular providers like American Well, there's a host of companies. They all support context URL linking. There's nothing stopping anybody today from setting up a configuration where you pick up the patient's contact information, pass it to a telehealth system, call the patient. You can think of a telehealth schedule just like an internal clinic schedule. Nothing stopping you from doing this today. Between the flags is an Australian term. It has to do with surf lifesaving, where they put flags between certain parts of the beach, and that's where the lifesavers are paying attention to you. This is early intervention on the slippery slope of patient deterioration. We've had some recent investment in our early warning scores. We now can tell the difference between a set that's not fully complete. You can define what constitutes a complete set and what isn't. We've done a lot of this work based on the UK standards. It's live in some of our UK clients now. Again, an area that there's a lot of value today. I'm going to move fairly quickly across this because Adrian's going to be going into more details, but there's a lot of interoperability in our pipeline. And our vision for connecting and coordinating care, again, is thinking about this exponential rate of change, thinking about how we can capture the data from all the different care settings and incrementally every year, every month, every new implementation, every new customer we encounter, how can we constantly be investing and bringing all this data back into the TrakCare system? User experience is a huge issue in healthcare generally. It's something that we're passionate about. We're involved in a multi-year journey on user experience. We began this journey and realized that in order to really hit where we're going with user experience, we had to tackle the user interface. So they're very related, but they're two different things. The user interface being the technology you use to interact with the TrakCare system. So we've introduced a new user interface. We call it the mobile-enabled user interface, but don't get caught up with the word mobile because it's not. It does work very nicely on mobile devices. It's responsive. It looks very nice on a mobile device. But this is what TrakCare will be looking like in the future. So all of our new development is being delivered in this interface. It exists side by side with the TrakCare user interface. So if you're an existing customer, you can implement it slowly, ward by ward, user by user. We anticipate this will become a bit of a viral thing where you'll implement in one ward and all of your users will see it and say, hey, we want that too. We're focused in T2019 on clinical workflows, but we're very quickly planning to extend this across the breadth of TrakCare. There may be some areas that, like code table management, where we'll choose to embed the existing user interface into the mobile-enabled user interface, but we believe we're ready to engage with clients who are committed to move forward with this interface. And I have a few more screenshots. I think you've all seen. I'd encourage you, if you haven't, to spend some time with our team at the demo stations. One of the things we've started doing is not demonstrating what we call the TrakCare user interface at events like this, because this is the future of TrakCare. This is what TrakCare looks like today if you're a new client, and moving forward a couple of years, this will just be TrakCare. We won't have to call it anything special. So our colleagues from class had what I think is a fascinating presentation. I'd encourage you to share that within your organizations. I think that's their data from providers is incredible. And one of the things we're working very closely with class and trying to bring those lessons into everything we do. Some of those relate to the product side, some of those relate to implementation or support or other parts of our business, but they're all very important. Personalization is one that struck out at us as especially critical. And the colleagues from class made some very good points about losing your personalization on your phone and that sort of thing. So we've recently produced a set of collateral about personalization in TrakCare. It might surprise you that there's more than 20 different ways your users can personalize TrakCare today. If you extend that to things that can be done at an organizational level or within the region, that number goes up dramatically. We've recently produced a set of videos and a brochure that we'd be happy to share with all of you. I think as you're thinking about clinical adoption and user satisfaction, it's really important to think about personalization. And I think you'll be hearing a lot more about some of these things from the class research as we move forward. So in our pipeline, we've got a major piece of work. I'm slightly running out of time, so I'm going to accelerate a little bit. As you know today, we've got two primary clinician interfaces. We've got our active clinical notes and our flow sheets. The flow sheets is used typically in critical care, might be in the ICU, but could also be critical care beds in an emergency department, and active clinical notes is used elsewhere. We're in the process of doing a major project where we combine them into a single clinician portal. So this is a new paradigm that includes what we think are the best of both of them. So you've got all of the monitor information coming from the machines available to you. You can click back and forth between a timeline view and a chart view of your data. You've got down the left a combined flow sheet actions and active clinical notes actions. You've got different views there. When you choose to enter a note or enter some data, so here's an allergy, enter, you've got along the left-hand side, this is a mini EPR, so the patient data is available to you in a seamless way within the same screen, without a pop-up, without having to go anywhere else. We've run some user experience testing. These are mock-ups, obviously, they're not real screens. We've run some user experience testing with a number of our clients. So far, the feedback has been great. We've had some very good feedback that's had us adjust our approach. This is something that's coming over the next year, and we think it's going to make a substantial difference in how clinicians use the system. And the vision for user experience, I think we all probably share this vision that as much as we love our technology and love our product, we'd actually like it to get out of the way. We'd like it to be there in the background to support the doctors, to support the nurses and the pharmacists, but not be in the way. The other thing I think we all need to keep in mind is the patient's role in user experience, because it's not just your clinicians, it's your patients. One of the things that I get really excited about with our mobile-enabled user interface is I'm seeing customers show the system to the patients, because being a standard-based interface, it's based on a standard web technology. It looks very familiar. Some of our denser TrakCare screens today are quite intimidating looking, even for our experienced users, and you can imagine a patient looking at those screens. The mobile user interface, I think, is well suited to having a conversation with a patient. Taking the computer screen away, doing more work on tablets, and really we're looking to build a product that clinicians love to use and patients love. So safety and compliance, we've got a great presentation coming from one of my colleagues who's our regional clinical safety officer. He'll tell you all about the ways that InterSystems has invested in the clinical safety process. I'm not going to go into a lot of detail about that. I also haven't spoken specifically about a lot of medication management development, but that's a huge area of investment for InterSystems. It's one that we're passionate about because our clients are passionate about, and it's important to understand the importance of closed-loop medication management and an increased decision support in terms of, from a safety point of view. The medical device directives in Europe are changing. This is pushing us down a road where we need to pursue CE marking. That's going to change a number of things. I think that's ultimately good for all of us, but it's an adjustment, I think, as an industry we need to go through to understand the EMR's role in the broader medical device world. And that's work that's ongoing today in our pipeline. And our vision, or my vision anyway, is about safety as a competitive advantage. I think it's a competitive advantage for us, and it's an advantage for you. Whether you're public or private, you're in a competitive situation. Your patients have choices. And I think the investment in safety, both from an organizational point of view in InterSystems as well as from a hospital point of view, potentially becomes a competitive advantage. So the last topic I wanted to cover is this idea of working together. So we've always used some form of agile development within InterSystems. For those of you who have been involved in technology and development, you'll understand that agile's been around for years and years. In the last year or so, we've made a big change into our the internal way we're organized to really embrace Scrum as an agile methodology for developing product functionality. You probably don't need to be too concerned with the Scrum process in general, but the bit that I think is important is every piece of work we're doing has at least one customer stakeholder attached to it. Not necessarily every tiny little change of adding a new field for a statutory requirement in some region, but any substantial project will have customer engagement. So, I'd invite you to talk to your local teams if you're interested in being involved. We're trying to work in a much more agile way with our customers. We're much better. I mentioned earlier with the changes we're making to active clinical notes, some of the usability studies we've done. So with those, we had a set of sessions with doctors in Scotland where we had them walk through a set of scenarios using mock-ups that simulate the application. We watched them work, we collected their feedback. We're talking to some of you in this room, we're talking to you about collaborative development projects. I think we're really trying to break out of that paradigm where we spend a year developing a major piece of work. You spend a year doing an upgrade, and then you go live with it and say, it's almost there, it doesn't quite work. And that's the most depressing thing as a software vendor, to put your heart and soul into building software to have it not used. So we're trying to embed that much earlier in the cycle. Active feedback, active collaboration, inviting our customers in. It could be virtual, it doesn't have to be in person, inviting them to sprint reviews, inviting them to look at what we've done on a 2-weekly basis. I want to find out if we've done something wrong after 2 weeks and not after 2 years. And I'm pleased to say we've made a lot of progress towards that goal. So the last thing I wanted to leave you with is what's next. I said at the beginning, I'm hoping that all of you pick up a few things from today that you can take back and use right away. Maybe you've seen some things from the presentation today that are interesting to you. I'd love it if you reach out to me. You can all have my email address. Let me know if you're interested in collaborating. We'd love to talk to you. We'd love to stay in communication and contact and work together. I'd love to see, I know several of you are involved in upgrading to T2019, our latest release. I'd love to see all of you plan an upgrade. I'd love it if you thought there's enough functionality coming down the pipeline to make you stay current, to make you continue with your upgrade projects. and to put all of this capability to use. There's things in all of your systems today that could add value to your organizations that you may not be considering, you may not be using. Go out to the demos, think about what you're going to do tomorrow to improve the outcomes in your organization. So with that, that's it for me. It's my great pleasure now to introduce you to one of our longtime TrakCare customers. Dr. Jenny Xiao is from United Family Health in China. They've been a TrakCare customer for about 10 years. And I think Jenny's gonna talk to you about her TrakCare journey,
Yeah.
and I'm sure you'll learn a lot from her. So thank you for your attention, and please welcome Dr. Jenny.